Okay, as Sandy just mentioned, this session will be recorded. And then what I'll do is put it up on YouTube, and I'll send you the link so that you guys can have that to review it here. Okay, let me go ahead and get into the system here. Okay, so we're going to start out, we're going to use our little demo organization we call USA Public Health, so we don't go in and accidentally mess up anything in your system here. So what we're going to talk about are a couple of things. We have this little program we call Tobacco 2021, and for those of you who have seen the introduction presentation, you'll recognize this here, but we're going to use that kind of as our demo to be able to look at the charts and graphs and that sort of thing. First thing I would like to offer is I'm pretty much assuming that most of the folks have been through the introduction training, that hour-long training that we go through. If you have not, Sandy has got a recorded session of that, and then there's also in the dashboard, there are video-based training modules, and I'll show you how to get to them. So once you log into the dashboard, you'll be at the main menu screen typically. You're going to go up here to the blue eye in the top right corner, and you click on that. That's your help and information screen. So basically, depending on where you are in a system, let me go back here. So if I'm at my services screen here and I click on that button, you'll notice it takes me right to adding and managing services. So it's context sensitive as to where you go. Over here, you'll have the, for the specific section you're looking at, you'll have all the buttons and the fields and everything defined in there. But the thing I wanted to point out up here is up in the top left corner, there are 5 video-based training modules. The introduction is the one I would recommend if you haven't been through our online training or live training, is to review that module. It's about 45 minutes long. But it does get you the big overview of the dashboard. And by the way, we're happy to do that as a live session as well. Just contact myself or Andrea, and we'll be happy to set that up for you. In addition to that, there's some more detailed training, VMSG basics video training, which is really very detailed about every field and every screen and every button on the system here. Operational plan development for those of you who actually want to develop a plan around something. It talks about all the different fields in the pyramid and the different things here. So each of these is somewhere around 45 minutes long. Performance monitoring, we're going to talk a bit about that today, and that's reporting and charts and graphs and dashboard and that sort of thing. And then for those of you who've been designated as org admin users, there's some talking here about managing user permissions, and we'll be talking a little bit about that today. So I just wanted to let you know that the training modules exist in the system. You can get to them and review them at will. They're all hosted up on YouTube so that we don't have any access issues typically for people in health departments to be able to get to them in there. So I'm going to go back to our group screen here. A lot of the tools that we're talking about today are specific to a group. So the first thing I just want to talk about is some reports. So we have this program called Tobacco 2021. And as I drill down through, well, first of all, let me just do a quick review on the pyramid here. Yeah, the screen. So this is the planning model that's built into the dashboard. So what we're talking about today is going to refer to this quite often. So I just want to kind of review it. So every plan in the system is in this model. The organization is the health department, in this case, Florida HIV. Underneath there are the groups, and we have a specific group for each of the departments represented in the program out there. And then underneath those groups are typically specific plans or the organization of your department. So it could be like HR and admin and community health and WIC and that sort of thing are different groups typically. Each one of those groups then has a set of services that they provide or initiatives that they want to provide in the future. Underneath each of those, we start defining those deeper and deeper, and we go down to the goals of that particular service or initiative. Underneath that, we have specific objectives, or what we call SMART objectives. So there's specific, measurable, attainable, realistic, and time-based objectives. So that's where we get down to what I call the what. What exactly are we trying to accomplish? And then for each of those objectives, there's typically a set of activities. And the activities are the steps you're going to go through to accomplish the objective. So that's what the planning model is here. And if I go through and look at this model for the tobacco program we're going to be using as an example today, USA Public Health is our little demo organization. The group is called Tobacco 2021. Tobacco cessation there's several services, and the one we've chosen is tobacco cessation. The goal here, in this case, one of the goals is to reduce smoking in high schools. That SMART objective, again, is reduce smoking at Wayne High School by 25% by the end of the school year. And then the steps we're going to go through to get there. So in this case, we kind of made these up, but it's going to create a training curriculum, going to provide 9 training sessions per month to student and faculty, and then we're going to contact local tobacco vendors just to make sure they're not selling to minors and that sort of thing. So that's the plan we're going to be kind of using as our example today. I just wanted to share that so everybody's kind of on the same page. So this is that group we were talking about, Tobacco 2021. As I kind of march down through the pyramid, which you'll see flipped on its left side up here on these tabs. So you select the organization, groups, service initiatives, goals, objectives, and activities. So I'm just marching down the pyramid as I go to the right on these tabs. So remember, we had tobacco cessation. We had reduced smoking in high schools. We had reduced smoking at Wayne High School by 25% by the end of the school year. That's SMART objective. And then the specific steps we're going to go through to get there. So that's the plan. So now the first thing that we're going to talk about is reporting. Now, we're just going to pretty much talk about one report today, and that is the operational plan report. Reports are specific to a group. So I'm going to go down and select this group, Tobacco 2021. I could select anything, a strategic plan or the child chip, anything like that. But in this case, I'm selecting Tobacco 2021. So the report I'm going to generate is specific to Tobacco 2021. I'm going to go up to my reports menu, this little blue guy up here, click on that. There's a lot of different reports in here, but the one that you'll use probably 90% of the time is this top one called the operational plan report. I'm going to click on that. Now, and we'll talk about hiding services a little bit later here, but what it's asking me is, do I want to present information from services that have been hidden or not? And I'll say no at this point in time. It's going to go through and generate the report for me. So what I have here is we have a vision, mission, and values for the tobacco program, which shows at the top of most of the reports up here. And then as I go down to the report itself, it's in that pyramid hierarchy here. So we have the group, Tobacco 2021, the initiative, tobacco cessation, the first goal, reduce smoking in high schools, the objective, reduce smoking at Wayne High School, and then those specific steps we're going to go through. So this is what I say is the most detailed performance monitoring tool, because it's got every piece of detail, including any notes and things that you put in there. So you can always go to this particular report. Up in the top right corner, you may want to look at the report in different levels. So for instance, you may just want to see the services on there and not the goals, objectives, and activities. So you go down here and you can see we have 3 services or initiatives in this case. I can look at the goals too underneath those initiatives. So you can see we have, in fact, just initiative 1 has 3 goals on it down here. Underneath that, I can look at the objectives. So I can go down here and see that we have goal 1, objective 1.1.1, the 2 objectives. So we have the reduce smoking at Wayne High School, reduce smoking at Desert Vista High School, and you can see we have the notes in there. And then we get down to the activity level, which is the deepest level, getting all the way down to the bottom here. So I can see that. Now there's several options up here. This button will allow you to show specific date ranges, and that date range is the end date of the activity. So if the activity is supposed to end on 6/30/22, you can go in and say, I just want to see things that are 1/1/22 to 6/30/22, and it'll show you just those specific objectives. If there's any documents attached, I think many of you have seen the document management piece here. If there's any documents attached, I don't know if we have anything attached in here or not. No, it doesn't look like it. You'll see a little green line wherever it is. It could be, at the initiative, goal, objective, activity level. You'll see a little green line that says document abc.pdf is attached or something along that line. You can also, if you want to have a report that doesn't have any of the notes in it that you see in blue here, you can hit the hide button here, and it should hide the blue notes in there. And you'll just have so you just got the plan basically in there without the notes on there. So back to here. You can also say, I just want to see a specific status of the traffic light. So I want to see all the completed ones, the green ones, yellow ones, or red ones in there. Um, then up here, like I said, in the top right, you can look at the different levels. So this report is like I say, it's the most detailed level of performance monitoring in the system here. Now I'm going to go back here, and so we have tobacco cessation. I'm going to go down and look at a couple of other things in here. So number one, I want to show you at the objective level. Now, typically, if you're checking status, you're checking at the objective level because, again, the objective is the target. What are we trying to accomplish? In this case, reduce smoking at Wayne High School by 25% by the end of the school year. So a very finite target. Now, if I want to see how we're performing against that target, it says down here the reduction is 25%. I want to go up here and use this little chart button right here. And that's going to show me over time exactly what happened. So we start out obviously with zero reduction, and as we ramped up our program, we got up to our 25% reduction. So this is showing me the status of that particular objective. You have this chart at the goal level, the objective level, and the activity level, so you can look at it. And this is kind of how you go in and say what's going wrong or what's going right in here to be able to look at that. So as an example, we have another example here, reduce smoking at Desert Vista High School. So the Wayne High School one was good. It was green. We have a yellow light here indicating something potentially going wrong. You can see, pardon me, down here in the notes field, not quite to the 25% target, COVID restrictions on training and vendor visits. So what that's saying is we have an issue. We've marked it as yellow. And I can go in again, look at the chart on this one. And you can see the kind of the same ramp up period, but we capped off at 21%, never got to that 25%. So now we know we have an issue, and to be able to kind of dig down and figure out why we have that issue is when you go down to the activity level, and you'll see the activities. Gold bar indicates successful completion. So the first one of creating the training materials is done. The second one of doing 9 training sessions each month is red. But again, going down to the notes field, says training slowed down due to COVID. I probably want to look at the chart on that one as well. And this is that the activity is saying, okay, we ramped up and did 9 training sessions a month for about 3 months, and then we started dropping off. And the example that I use in this case is maybe this is the time when students started, using Zoom sessions and learning from home, so that we couldn't go in and do the training at the schools in here. So we're dropping off and then kept dropping down here. So we're at the red light, meaning we're below the level of 6 here. So that's obviously one issue, is we can't get to the students to do the training. And then the other one is contacting all 20 tobacco vendors within a mile of Desert High School to assure they're not selling to minors. And again, we can look at the chart here, and it says, we ramped up, we contacted 7, 11, 12, 14, got to 15, and didn't get to contacting all 20 people. So again, that's an indication that potentially why we're not meeting our objective. So those are the performance. We call those micro level performance monitoring charts, because you can monitor each specific activity, objective, or goal using those charts in here. Okay, so now I'm going to go back to my groups tab, and since we kind of have this one set up already, I'm going to look at community health division. So when I pick a group, I can look at a dashboard for that group. And the dashboard is the summary of how the performance of any plans under that group are going. So what I do is I select the group over here, and then I'm going to go up to the traffic light. I'm going to select the traffic light, and it takes it about 10 seconds to calculate the dashboard here. So I can look at my entire organization or any piece of the organization or any plan. And I know you guys have plans divided out by local health department here. So you can look at the local health department. In fact, we could do that if you wanted to a little bit later. What we're looking at here on this dashboard is the yellow, the green, yellow, red, and gold status indicators, how many there are at the activity level, objective level, and goal level over here. It says I'm looking at community health division under USA Public Health. This gauge here is telling me how am I doing against my schedule. So remember, every activity has got a timeline associated with it. So it's a beginning date and ending date measured by percent complete typically. So it's just calculating that. It says we're 198 days behind schedule, which, by the way, nowadays is pretty typical because of COVID. Most people, were out doing COVID-related things versus, working on the dashboard and such. This is color coded. So over 60 is red, 0 to 60 is yellow, and on or ahead of schedule is green. So it'll automatically tell you that you're, hey, you're a bit behind schedule in this case. Down at the bottom, you can look at each of your people down here and see that they've been assigned specific activities. You can see the last time they were in the system and did their updates in here, color coded over 60 days, under 30 days, and 30 to 60 days with green, yellow, red. Won't talk about FTE, it's really not relevant right now. Lagging is saying that we have, Diane has one activity that's lagging. You can see it's yellow, so it's 30 to 60 days behind schedule. The days column is the same as the schedule gauge. So overall, for all the activities Diane's been assigned, she's 294 days behind schedule. Overdue just indicates that we're past the end date, we're not complete. And then a number of red, yellow, green, and gold over here. So just gives you a good ability to look and see how your people are doing, especially when you've asked them to do regular updates on the system. You can go down, look down here and say, hey, you're 60 days behind schedule. What's going on? What can I do to help you to get back on track here? The other thing up here is called My Priorities, and that is individual objectives that you personally want to keep your eye on. When you're on the objective screen, you'll hit a checkbox. They'll show up here. And what you're doing is saying, these are the things that I want to keep my eye on. They're attached to my user ID only. So the only person who'll see the ones that I've selected is me, and anybody else can obviously select the same things, but it's things that you personally want to keep your eye on. Everything on this screen is clickable, so I can drill down and figure out, what is this activity that's red? I can look at that, maybe make some corrections and get it back on track. So that is the dashboard screen. And I just wanted to kind of show you guys something else that we've been doing a lot of times during COVID here, and that is, where to go? Dashboard. What we did is we added a VMSG mobile version to the dashboard. So that screen that you just saw on your computer is the same as what you'll see on your phone if you log in, except it's now 3 screens. So the top left corner, the bottom, and the top right corner of the dashboard screen show up on your phone. You don't need to do anything. There's no app to load on your phone. It's automatic. So what it does is dynamically build the app in the web browser on your phone. So if you go to the login.vmsgdashboard.com URL, the link, and you log into it on your phone, it's going to take you to the dashboard or the mobile version. You can go in and do this, and then there's some other features in there that you can do as well. But it's now available to you to be able to look and monitor things that way. Okay, so that is the 3 primary areas. You got the micro level, you saw at the activity and objective level, the charts and graphs. You got the macro level, which is the dashboard here, so the big picture at any level, depending on the group you select. And then you saw the reports. You can generate reports again at any level, and you can include, if you wanted to, you can include the whole department in one report. I don't recommend it. It'll take a while to print out that report, and it typically is too big to be of much value in here. So that is the first thing I wanted to talk about was how to monitor the status of things that you're doing in the dashboard. Before we dig a little bit deeper into being able to kind of look at different things and move things around in the dashboard, are there any questions on any of these tools?
Fred, I just have a comment just for everyone. So what Fred just did was just to provide you a high level, wonderful overview of how you all can continue to monitor your progress as a county related to your achievement towards your EHE work plan. Now you all will primarily have access to your individual county work plans, but they made it where you will have access to one another, other counties' work plans as a read only, because as you're continuously making updates to objectives, activities, and we're all one state. So if you need some type of just guidance or to see how Broward versus Orange with Hillsborough, how they're progressing, that's just a good visual. But it's good to continue to be proactive with like updating, and you won't have to feel you have to always go on the screen, because Fred, if I recall, the individuals will receive alerts via email.
Yes.
On the activities. Okay.
Yeah, I'll tell you what, let's go ahead and throw that in here just for those people who haven't seen it yet. Let's talk about the quick update here. And I'm just going to kind of go through it briefly here. Let me go back to here.
We'll start from how the screen, either of the screens where the anything could be assigned to you, because I know Reggie and I, we try to assign different activities to the EHE coordinators, but once you all had access, I know some counties have multiple users, so it is relevant to assign different activities or if it's by pillar, to an individual so that they can always keep track of the different activities and objectives.
Yeah, let's talk about that. So I'm going to select your group here and down looking
Okay.
at the group so you can see the Broward, Duval, everybody down in here. What Sandy was talking about, one of the things is the ability to assign users with specific privileges. So I'm going to go up to your main menu and then select users. And let's go ahead and select Sandy here. So you have a lot of information about the users down here, but you have different levels of access. In this case, org admin is the highest level Sandy has. But what she was talking about is the ability through this group links button here to assign privileges. So in this case, Sandy has got view privileges and edit privileges to everything in the system, so all the different counties. Probably what she was mentioning is that if you're from Broward County, you'll have view and edit access to Broward and just view access to the other ones in the system here, to whatever level you guys want to be able to share. But what that allows you to do is to edit anything in your particular group, but just view things in the other group. And realistically, you can generate charts and graphs and reports from the other group. You just can't change anything in there. So that's how you can set up the permissions at this level, at the group level, so you can see anything you want. The other thing is, in some cases, you might have some plans that are being put in there for future use. And what you can do at each user level is say, let's say the agency strategic plan is not ready yet. I just want to be able to develop it in here, but I don't want other people to be able to see it. I can just uncheck the view. And when that person goes to their group screen, they don't even see that it's in there. So you can develop things in the background or things that you're going to be doing in the future and just remove that permission for now. Then you can always just go back in and hit it there. And now they have view and edit privileges for being able to do that. So you have the ability to manage the user permissions at the group level in here. The other thing that you can do here is this admin links button. What that does is say, and right now we don't have any assigned, but what you're saying is if I get an email notification, which we'll show you in a second here, and I have a question, who can I contact? So in this case, I'm just going to go ahead and set Sandy to be the contact for everybody for now. So what that'll mean is you'll get an email, and at the bottom it'll say, if you have any questions, please contact, and it'll have Sandy's phone number and email address on it. Save that. So, and we'll show you that email here in a second. So those are the things that you can manage at the user level. You've got to be an org admin level user to be able to actually make these changes in here. So just contact Sandy if you have anything that you want to be able to see, or if you work with another county and be able to edit information that they have, that sort of thing. Okay, what I wanted to talk about just for a second here is this thing we call intelligent real-time planning. And this is the automated email notifications that come out on a regular basis. We can look, in fact, let's look and see where you guys are set up right now. If I go back to the settings down here and look at notifications, it says right now your emails are turned on. Week 4 on Friday, everybody will get an email. Now, the emails only come out based on 3 criteria. Number 1 is if you haven't updated your stuff in 30 days, you'll get an email. If anything's behind schedule, so every activity's got a beginning date, ending date, and percent complete, and it's just calculating, if you're halfway through the time cycle and you're 50% done, you're right on track. Halfway through the time cycle, 40% done, you're behind schedule. It's going to ask you to do an update. And then overdue, just indicating that the activity is not 100% complete and it's past the end date on the activity. So this is when you should expect to see Friday on the 4th week of the month, you should expect to see an email notification come out based on these 3 criteria. Okay, back to the main menu, back to here. Okay, so you guys have it set up once a month on the fourth Friday of the month. So here's what happens on that fourth Friday at 1 o'clock in the morning. The system goes in and it'll look at every user in the account who's been assigned as an activity lead or an objective lead. In the pyramid, you assign people at the objective level and the activity level to basically manage those pieces of it. It's going to look at those and it's going to ask those three questions. Have you been in the last 30 days? Anything behind schedule? Anything overdue? If any of those is true, pardon me, out go the emails. Right now, the emails are primarily going to your internal folks. A lot of people like to use this to do, for instance, their community or state health improvement plan, where they bring a lot of external partners in. So if you got external partners involved and you want them to be able to do direct updates on your plan, you can have the emails go out to them. We're happy to train them on how to do it. It's a pretty quick training that we're kind of going through here. Allows them to be able to, provide input directly instead of you having to call them and say, hey, how are you doing on this particular activity? And then go back, log in, putting in the system. System will short circuit all that for you. From there, you're going to be taken to the quick update screens. The quick update screens, I'll go ahead and show you. I'll probably have to log in as a different user to show you that. But the quick update screens are just a very simple way to do your updates in here. And then you're going to log out. Just to give you an idea, across the 240 some odd departments using the system across the nation, this is about a 3 to 5 minute process once a month. So it's a very simple process to be able to do this. Now, I mentioned that email that's going to come out. It's going to look something like this. Those are those three criteria. It's going to say, why you got this email. So, you're just 2 days ago, so that's not why. You don't have anything behind schedule. Oh, you got 6 activities overdue. Okay, that's why I got this email. And for all the activities you've been assigned, you've got a status flag here, red, yellow, green, and gold. This is that thing I just assigned Sandy to. So you're going to get in your email, it's going to have Sandy's name down here, her email address, and her phone number. And then there's the link to go log in. When you click on that link, it's going to take you into the dashboard. Hang on a second here. So I'm going to take a second here. In fact, for those of you who haven't logged in, let's just go through that process here. I'm going to log out, click on that button, hit log off. It'll take me back to the home page. So I'm going to go up to the right corner and click log in. So the first thing you'll do if you've never logged into the system is you're going to go and hit the send button. It's saying send me my login credentials. So I hit send. I'm going to put in here my email address and I'm going to hit send again. If it finds all your user stuff in the system, it's going to say success, meaning it found you and it sent out an email to you. The email is going to go out and it's going to look like, this. So it's going to say, here's your user ID and your password. User ID can either be the assigned user ID, which is first initial last name or first name dot last name, something like that, and a cryptic crazy password in here. So then I'm going to be able to go back and hang on here, hit the login button. It's going to ask me for either my it's going to ask me for either my username or my email address. Either one works fine. If you don't want to remember a new username, go ahead and use your email address. Your password, if you're using things like Google Chrome, it'll save all that for you so you don't have to go put it in every time. And then you can hit the login button. Now, if you have been assigned at the activity or objective level, it's going to ask you, do you want to go to the quick update screens or the main menu where we've been before? I'm going to say quick update. The quick update screen, it's going to walk me through the activities and objectives that I personally have been assigned. Now, it looks a little complex, and the reason is because we have the whole context up here of the pyramid. So we got the group, service initiative, goal, objective. It says this is activity number 1 of 6 that I'm going to be updating, defines the activity and its performance metric, which is how do I know when I've successfully completed the activity. But there's really only 3 fields to update. You can cycle through the traffic light just by clicking on the light. You can put in whatever data value, however many meetings you're scheduling or whatever it happened to be in there, and you can put a note in there if you want to. When you're done with that, you're going to hit this little button on the bottom right. You're going to go to the next one. So you notice it says I'm on activity 2 of 6 up here. So I'm going to cycle through all of the activities that I've been assigned. I'm on the last one, 6 of 6. When I hit the next one, it's going to say, hey, no more activities were found, but you've been assigned as an objective lead. So I'm going to click objectives. It's going to take me to a very similar screen. Now remember, in the pyramid, the objectives are above the activities. So here's my objective. Again, 3 fields: data value, traffic light, note. That's all I have to fill in here. But if I want to go to the activities related to that objective, I can go click down here. The blue lettering indicates that this activity is also assigned to me personally. The gray lettering indicates that it's an activity under the objective, but it's been assigned to somebody else. I can still go in there and take a look at it and update it if I need to, but it should be updated by somebody else. And then I'll cycle through all of my 11 objectives in this case and log out. And again, once you get used to doing this, it's about a 3 to 5 minute process every month to do this update. So it's very simplified. It's very efficient to be able to collect all that information. Oops, let me go back here. So I can go back. And by the way, if you're using document management to attach documents, it's right here as well. So I can attach and modify documents that are attached to that particular activity or objective right on this screen. I'm happy to do the training for you on that, but if you go to any of the training modules in there, the basics talks about document management. It's a very simple process to update your documents in there. I'm going to go back to our main menu here. So let me go back to groups, and I'll go to our, see what I have under community health. Okay, yeah. Couple things that we can talk about. You'll notice that this tobacco cessation program 2019 is grayed out. The reason it's grayed out is because this hide service checkbox is clicked. Here's when that's useful. As you notice, it's 2019, so it's an old plan that we completed in 2019. I want to keep all the information available, but I don't want it to show up to normal users in here. So I just hit this hide service, hit the save button, and I check that. So if you have plans that you're not using yet, or you've already used and you just want to keep an archive, that's what this is all about. When I check that and I save it, nobody can see this except org admin users and manager level users. Everybody else who's a normal user in the system, partner user, read-only user, can't even see that up there. So it just doesn't appear. It doesn't appear in any of the reports. And if you remember that button when I was doing the report, it asked me, do you want to include hidden services? And that's where that comes in here. You can say yes or no if you're an org admin or a manager user. Otherwise, you don't even get the option to be able to do that. So that's one way that you can kind of move things around and hide them. Another way to do that is you have the ability to copy and paste at any level in here. So if I have this goal of, let's go down to an objective. So let's say I have this objective and I want to make a copy of it that I can put somewhere else. Let me see here. If I go back to, yeah, let's just go ahead and make a copy of this. So when I make a copy at the goal level, it's going to copy all the objectives and activities underneath it. And what you can do then is make that copy, and typically you can move it somewhere else to a different group. And then you're going to call that group an archive, and then you can go into the permissions at the user level and say, nobody needs to see this except me, take away all the permissions. So some people were asking about how can I put things on hold for a while? Well, that's the way to do it. You make a copy here. So I'm at the goal level. Click on this little 2 papers button, copy it. You notice the little paste button next to it lights up. So if I want to put it back in the same service, I can do that, or I can go up and say, oh gosh, let's put it to health preventive collaboration. So I'm putting it under another group, and I'm just going to hit the little paste button here, and it's going to ask me, what do I want to do with the traffic lights? Do I want to leave them as are, copy them, turn them red, or turn them green? I'll just say let's copy them in here. What it's going to do is create that group that I just had, and it says copy down here. So if you're doing it on the same page, it just allows you to understand which is which because they look identical, and they are identical. So I'm going to save that. So now I have It's identified as the copied goal down here. And then when I drill down from this copy version of it, I can go down to the objective level and see that I have same objectives, same assignments, everything else, same activities, everything's in there. So I can make identical copies of any portion of the plan from the group level all the way down. And this is one way to go about saving things. So at the group level, you might want to make a copy of the Tobacco 2021 program, put it under an archive, put it under save for later or something along that line. That way you maintain all of the plan, but you're able to move it around so that it's not in public view. And then you go into the user screen and make those changes in there. So those are kind of the ways, at the user level, you can hide groups from them with the view and the edit buttons in here. You can use the copy and paste function in here to move things around so you can kind of get them out of your way. And then the other one is being able to actually hide a service in here using this checkbox down here. So those are kind of the ways to put things in and out of view with different people. So those were the primary topics that I was asked to cover today. Are there any questions on anything we've done so far? And if not, let's just go into an open Q&A period where you have any questions or anything you want to see.
Hi, Fred. This is Chris from Pinellas County. I do have a few questions, one of which, when you asked for questions earlier, I had forgotten my question, but now I remember one from that has to do with the documents feature in the operational plan report.
Yes, sir.
Could we go there very quickly, please?
Sure. Hang on. Let me find it.
Okay, thank you.
Let me go down to my tobacco. I think I have documents attached. Let me look down here. If not, we can certainly attach one.
Okay.
Let me go somewhere else so I don't. This is kind of my normal demo here. Okay, so yeah, here's a Safe Kids program. There's a document attached down here. So this is document management. Shows up on every screen. What would you like to see?
So in the actual operational plan report, I remember there being like a checkbox that you can select.
Yeah, let me show you that. So I'm doing the operational plan report for community health, and I'm going to go up and do that. Nope, don't want to see hidden services. And that's this right here.
Yeah, so my question is that just simply a filter button that allows you to see which of, I guess, the parts have a plan or have a document attached?
Exactly.
And if so, then does it show the actual document in the report, or does it just simply show you that you have a document?
It's this right here. It's this green line, and it says this document called Safe Kids Op Plan 06/2018.htm is attached.
Okay, gotcha. So it shows that there is a document attached.
Yeah, and it shows, and you'll notice down here, same thing at the activity level, you can see the document down here, it's attached. So it'll show you documents that are attached anywhere throughout the plan.
I have a follow-up question to that, and this is something that perhaps Sandy could shed some light on. I'm just trying to think of some examples in which, just some general examples, more so in our day-to-day work within VMSG that would require us or would allow us or be beneficial to upload documents to.
Of course.
Let me tell you. Go ahead, Sandy.
Yes. No, Fred, you want to go first?
Yeah, we have lots and lots of different things that the system is used for. So let me give you a couple of examples. Tab accreditation is the big one. I mean, that's what most people use the system for because it's a requirement to have a performance management system. And what you have to do is submit literally up to 1,000 documents up into FAB. So what they do is through the accreditation plan built into the system, they attach the documents there so that they always kind of have them where they are. The other thing is think about managing a grant, for instance, where you've got the grant information you get from the grantor, and then you've got the things, the proof and such that you have to be able to provide back to them. So in that plan that you build around the grants, you attach those documents so you know exactly where they are. So that really, it's kind of a very safe place because they're all stored on a secure server and they're backed up every night. The accreditation process, and you can probably relate this to other processes, is reaccreditation is a 5-year process in FAB. So you're starting to collect documents today that you're going to use 5 years from now. If you don't have them in a secure place that you know exactly where they are, know where to find them, good luck finding them 5 years from now, when they're on somebody's hard drive or a network drive or a jump drive or something like that. So those are the kind of things that they're used for.
Okay.
Right.
Thank you.
And to just to even go deeper to that, like with like Pinellas, you guys are achieving a lot of community engagement efforts. So when you guys collect, if it's like the monthly reports that you want to include as the, if you capture all of them in one PDF document, that could be uploaded. Or if you have the attendance or training, say if there's an activity indicator that highlights X number of providers were trained, you can provide either like the curriculum or even like the attendance, but whatever was used that was captured from that specific event, and that's used for evaluation purposes. Because like I mentioned earlier this week, we do have an evaluator that will be reviewing all of your plans or work plans just to see your progress to date. So they would be reviewing some of the documentation to see how far you guys are in your progress. Does that answer your question as well?
Yes, it does. And excuse me for going down a question rabbit hole, if you will, but could you show the process for uploading a document? Or maybe not the process, but sort of, is it that plus button at the bottom right, or how would that be done?
We'll go right through the process. Let me just take it back down here. I just like to get in places that makes it easier to show it here. And something else I wanted to show you, in addition to documents, you also have this button down here at the bottom called source. A lot of times when you've got an activity and you want to be able to say, where am I getting this data? And you go back a month later and say, where did I get that data? Well, down here you click on this and it says you can define what it is, just a text definition, and you can put in a link down here. So what I can do when I do that, I can show down here this link button, and I can go in and say, oh, I can go to VMSG dashboard, or I can put in a link to CDC website, or I can just put a description in there that says I got it off our network drive on this particular file folder or something along that line. So that's one thing you can do as a reference point. But document management is super easy. So I'm at this particular, so I want to include a document related to installing 20 car seats a week. This button right here on every screen is the blue folder. Click on that. I'm gonna go down here. If I don't have any, it doesn't allow me to enter anything. It says you got to hit this button first. So I click on that, choose file, and I'm gonna go in here and find, let's see, I have some test files in here. Oh, hang on a second. I'll just pick a form here. So we'll call it VMSG letterhead. Open that up. It says upload the file. Boom, I upload it. The file's in there. Now I'm going to put a description of it. I can go in and change the traffic light. A lot of people, here's what people use the traffic lights for mostly. Yellow is a draft. Green is a final file. And then in the case of like accreditation, where you have to submit it, use the gold bar saying it's been submitted. I can put in here first draft. And then this is a field that may or may not be of value to you. In accreditation, when you're doing that, you have to submit all these documents, and every document's got an expiration date on it. So for instance, your chip has got a 5-year expiration date. Your strategic plan, I believe, is 5 years. Workforce development's 3 years. So what you'll do is when you upload this document, you'll put the expiration date down in here. So when you're getting ready to send it up into the EFAB system, you can go in and say, hey, this is getting too close to expiration. I need to update this file. Then I'm just going to hit the save button down here. Boom, the file's up there. I can get to it. I can click on it here. I can click on it down here. I can click on it down here. It just gives you lots of ways to get that file. It'll download the file, tell you to save it somewhere, and it's all yours. So it's real simple. That's the document management process. Now,
if that date is irrelevant to you, like the expiration date, can you leave it blank?
Yeah. Or just leave today's date in it, whatever. Yeah. Now,
okay.
The other thing you can do, and let me just show you exact same thing. I'm going to go ahead and say I'm going to upload a file again. I'm sorry, hit the right button here. Choose file. I'm going to do VMSG letterhead again. Same file, say upload. VMSG file copy. Now I'm going to save that. Now you notice it only shows one version, but it shows version 2. So I say show all versions. It automatically does version control. So if I'm putting the same file name up there, it's going to keep version control of that file automatically for you. What else can I show you?
That's it for me. Thank you both for answering my questions.
Oh, you're certainly welcome. Any other questions?
Hi, Fred.
Yes.
Yes. Hi, this is Gabriel from Miami-Dade County. Can you go over really quick where to put like a link again?
A link for?
Yes, like a link. I mean,
yes.
you already showed us like a file.
Yeah, right
now,
down.
Okay.
The source button down here, if I click on that, pops open this little thing. First thing you're gonna do is put in a description, and then down here, you're gonna type in the web link. That's all you gotta do.
Okay.
And when you do that, then this little link button shows up here. If I click on that, it's gonna take me to the VMSG dashboard, which is where the link was going to. Does that answer it?
Yes, thank you so much. I just had it like in Zoom and like zoom in, and I didn't see where you go.
Sorry.
My second question is regarding the emails that we'll be getting. I have 2 other leaders for, in the plan. Would I be copied or would I be sent those emails as well? Like, I just want to know if that will be possible.
Yeah,
because I have to
how that
entering
works. So at the activity level, you can assign multiple email recipients. So let's say this activity is assigned to, when I click on this, cancel that. Okay, let me save that. So I go down to here and let's show everybody. So you can see Diane right now is the only person assigned the email. But if I want William to receive it too, I can have 2 email recipients. So what you do is put your name in there as an email recipient, team member and email recipient typically, and then you can get the copy of the email as well if you want it.
Okay, perfect. So there could only be 1 leader, correct, for that activity?
No, you can have multiple leads. Now, right now it's probably set. So it's set for multiple leads. So you can have as many leads as you want in there, but typically you have 1 person who's leading it, and then the other people are team members like over here.
Okay, right now I'm checking and I only have, I only can put 1 person as a lead of the activity.
Hang on a second, let me see.
Am I able to do that? Do you think that's on me to do that with her?
Say what?
Is that because she is, I think the jurisdiction, the counties are activity leads. I'm forgetting like their level.
Yeah, so it's set to allow multiple activity leads, yes. So you can have multiple leads in there. That's what this setting is on your settings. Well, hold it now. Hang on, I'm looking at the wrong one, sorry. Let me get back to my admin login here. Sorry about that.
This is Miami-Dade.
Yeah, I'm just going to look at your account here. Okay. So let's go look at your settings. Yeah, so you don't have multiple leads activated. You want me to set that on?
Sure.
There you go. So now you can have multiple leads. You probably have to log in again to get that, but you'll be able to set multiple leads on there, and you can have multiple email notifications as well.
Okay, perfect. And another question, I honestly can't remember if you went over this, but basically the difference between the lead and the team. So for example, I have 1 activity, right? That, I will be providing, I will enter in the information, and then another user will be entering information as well to that particular activity. So does it mean that both the team and the lead will be us 2, or Like, I just want to differentiate between team and lead.
Yeah, you decide who is who on there. In this case, we have, hang on a second. Oh, okay. I'm not sure why it's showing that way. It shows,
And that's everybody across Florida.
yeah.
Yes, for instance, that one. Okay, so I mean, he will be, I mean, in this case, Alejandro will be the only one, you know, entering information there because I don't have anything. But let's suppose that I will be entering information as well. So both of us will be team and both of us will be lead, correct?
You don't have to be leads in order. Well, the lead is the person who gets the email notification typically, and that's here. But you can mark somebody as a team and a lead, and then turn off the email notification. But the lead is typically just the person designated to own that particular activity. You can call people leads if you want to. In this case, you can have multiple team leads, but most often you're just going to have a team lead with the email notification and a team member. But again, if you both want the email notification, you can set it that way.
Okay, thank you.
What else? Sandy, anything else you'd like to go over?
No, you covered a lot. I know everything was exactly how I pictured you were gonna go. This was perfect, especially
great.
for right now.
Well, I tell you what, if there's anybody who wants to go through the introduction training live, we'll do that. If you want to go through those learning modules online, please feel free to do that. And if you have any other questions that pop up as you're using the system, feel free to reach out to me, and I can pop open a GoToMeeting and walk you through whatever you need to have done.
Thank you so much, Fred.
Okay, well, everybody, thank you so much. I know it takes an hour out of your day here, but I thank you so much for taking the time to listen today. And again, if you have any questions, Sandy's got all my contact information. Feel free to reach out to me anytime.
And Fred, I know you'll email me when you have the recording and all of that set up.
I will do
Okay.
that.
Thank you so much, Fred.
Thanks, everybody.
Thank you.
Let's have a good one.
You too. Thanks. Have a great day. Bye.